Good morning, everyone, and thank you for joining us on today's podcast. My name is Andy Shepherd. I'm the clinical lead, and in today's session, we're going to be talking about how to improve your reproductive health. So, thank you for joining us. Don't forget to subscribe and click the bell notification. Leave a comment if you have a comment anyway through, or if you're watching this back, leave a comment. I always like to read through the comments and respond to them. So, today we're talking about reproductive health. Now, most of this is going to focus on female reproductive health. And the reason that is that the number one elephant in the room when it comes to fertility issues is a condition known as polycystic ovarian syndrome. So polycystic ovarian syndrome, poly meaning many cysts on the ovary. So many cysts on the ovary leading to problems with conception. It's the leading cause of infertility in women of reproductive age. So the number one elephant in the room when it comes to struggling to conceive is that the female may or may not have polycystic ovarian syndrome. In a recent survey, about 40% of females met the criteria for polycystic ovarian syndrome. It's really, really common. And there's a very simple solution to it, which is why I get really excited about presenting on this type of a topic. Okay, so the other thing I meant to say is that the content that I cover here in terms of food choices for reproductive health absolutely applies if you're male. Now, a lot of male issues, low sperm count, erectile dysfunction, have been linked to hyperinsulinemia, so high levels of insulin in the body, which is also what causes polycystic ovarian syndrome. Both of those are driven by sugar and carbohydrate. So there's a lot of kind of synergistic information here that will work on both sides, which will work to improve male reproductive health and also to improve and potentially eliminate, and I've seen that a few times myself with my own patients, eliminate polycystic ovarian syndrome and allow ovulation to occur again, and ultimately for the conceival of a baby. Okay, so with that, let me just share a couple of slides here. So we'll just jump into what polycystic ovarian syndrome is in these slides here, and I'll talk about the reason that the criteria for polycystic ovarian syndrome happens. So the reason you get the hair growth, the reason you get the lack of ovulation, and the reason you get the cysts on the ovaries. And with that, I'll be able to explain how to reverse polycystic ovarian syndrome all in 15 minutes. So starting with what PCOS is. So PCOS is a cluster of symptoms. So basically, if you have two or more of these criteria, you can consider yourself to have PCOS. Now, I can't make that diagnosis. I can't even tell you that you do have it if you have these, but I can say go see your doctor and just discuss whether you may or may not have polycystic ovarian syndrome. Some of the obvious things you'll see with PCOS, and again, if you're just joining us, this is the leading cause of infertility in women of reproductive age. So if you know a female who is struggling to conceive and it's gone on for a while and they've done IVF and they're at an age that's, let's say, below 40, chances are, you can't guarantee, but chances are that there's PCOS at play. It's by a mile the leading cause of infertility. Really, really common as well. So PCOS is two of these three criteria, risk factors, or symptoms, I should say, and you have PCOS. One is hyperandrogenism, which sounds like a very long, complicated thing. Androgenism means male hormones from androgen. Hyper means, well, obviously high. So high levels of male hormones. So typically that's testosterone not being bound up in the body. And there's a reason that happens. It comes back to a hormone called SHBG, but I'll explain that in a second. Oligo or anovulation. So we know what ovulation is. Oligo or ano means no or sporadic. So little or no ovulation. And then polycystic ovaries themselves, you get an ultrasound done and they spot that you have cysts on your ovaries. Now, the more obvious signs of PCOS from a visual point of view would be unwanted hair growth. So high testosterone levels leads to that hyperandrogenism, which will usually be expressed in facial hair or dark hair on the arms. That's not to say anyone with dark hair on the arms, if their female has polycystic ovarian syndrome, but it is a classic kind of expression of PCOS insofar as the hyperandrogenism is concerned. The first one, let's take a look at this, the hyperandrogenism. So the cause of high male hormones. You might look at this and think, well, what would cause male hormones to go high? And it's actually our friend insulin. So when your blood sugar levels are high, so again, think cakes, pastries, donuts, but also bread, rice, pasta, all that sort of carbohydrate-based food, insulin goes high. Now, we know that's a problem for blood pressure, for cancer, for diabetes, weight around the midsection, fatty liver, I mean, most chronic conditions that you can think of are adversely affected, or in part at least caused by high levels of insulin. But what insulin does from a fertility point of view, it it has an antagonistic relationship with something called SHBG, meaning the higher insulin goes, the lower SHBG goes. So you might think that's great, but what in the name of God is SHBG? SHBG is sex hormone binding globulin. So if sex hormone binding globulin is low, it can't bind up testosterone and keep it in appropriate levels around the ovaries and the other parts, the face and the other parts of the female body where it shouldn't be. So if insulin goes high from high blood sugar levels, sex hormone binding globulin goes low, and its job is to bind up testosterone. So you get really high levels of free floating testosterone. So you'll see, if you look at a blood test, you'll see things like, you see testosterone, but you see free testosterone. That's testosterone that's not bound up in the body where it should be. So a certain amount of testosterone is normal in the female body. High amounts of testosterone will typically result in hyperandrogenism. It could be deepening of the voice in extreme circumstances, like in pro-female bodybuilders taking anabolic steroids, injecting testosterone. It could be unwanted hair growth. It can express itself as acne in a variety of other different ways. So the hyperandrogenism is caused by your blood sugar levels being high, which is great. So it's not some complicated, well, it's very complicated physiology, but it's not some complicated solution that we can't get to the root of. If you lower your blood sugar levels, your sex hormone binding globulin goes higher because your insulin has gone lower. Remember, that's a kind of a seesaw effect, or antagonistic as we call it. So blood sugar levels go lower, insulin will go lower, because insulin's job, remember, is to keep your blood sugar levels under control as well as other things. So insulin levels go lower when your blood sugar levels are better from eating less sugar and carbs. Sex hormone binding globulin goes back up, binds up the testosterone, and we don't have as much free tests floating around the body. So again, the root cause here is, for the most part, diet. Excuse me. So if we look at an ovulation, what actually happens from the ovulation point of view, the physiology is really interesting. When your blood sugar levels go high, again, this is the root cause of PCOS for the most part is insulin. Now, there are other things. You can get pill-induced polycystic ovarian syndrome, and there are other versions of PCOS. The vast majority of them are caused by hyperinsulinemia, high levels of insulin, and so related to diet. So if you have lack of or irregular ovulation, it's usually caused from a blood sugar point of view by insulin levels going too high. And instead of your body responding to luteinizing hormone, which is the hormone involved in bringing about the pre-ovulatory follicle, so it's one of the steps to ovulating. If your insulin level is too high, your body has basically, it has an overly sensitized and premature stimulation of a response to luteinizing hormone. It basically responds to luteinizing hormone way too soon. So when it's only up around 4 or so, it should be getting up to about 8 or 9.5, but before it goes into a pre-ovulatory follicle. So you're basically getting premature responsiveness to luteinizing hormone, and something occurs then known as follicular development arrest. So the follicle stops developing. And when that happens, you don't ovulate. So again, if we take a few steps back, if we reverse engineer it, if we can get insulin under control, we can actually reverse this process and potentially get patients ovulating again. And when I say potentially, I've seen this numerous times where I've had patients, every single time it floors me, where I've had a patient who, and I'll show you some case studies in a minute, excuse me, who they will openly say to me, look, I haven't had a cycle for 3 or 4 years. I haven't ovulated in 5 or 6 years. And I've had 3 or 4 rounds of IVF, and 7 to 10 weeks in, they're pregnant. I mean, it's frightening. And when I say I've seen that a good few times, I mean, I'm talking more than 5 times. Okay, so the third thing that happens with polycystic ovarian syndrome is where the follicle would normally go on to bring about ovulation, you get multiple immature follicles that have stopped developing, and they build up in the ovary, basically, instead of being released as would happen with ovulation. They build up in the ovary, and it causes the cysts to actually happen. So again, the cysts themselves, the lack of ovulation, and the hyperandrogenism, the high testosterone levels, are all caused by the same thing, which is high levels of insulin. And then if we look at how we traditionally treat PCOS, we don't look at the root cause at all for the most part. For the hyperandrogenism, for the hair growth, there's bleaching, laser removal, medicated creams. That doesn't address why it's happening. It just gets rid of it temporarily. For the lack of ovulation, we take metformin, which lowers your insulin levels. So that's why you take metformin. Clomiphene is a medication, full name is clomiphene citrate. And what that does is it encourages ovulation. And then IVF, in vitro fertilization, which is assisted fertilization that costs anywhere from 10 to 15 grand per round. And the average person will have 3 to 5 rounds before they conceive. So you're talking 50 to 100,000 for that to happen, which, look, don't get me wrong, is more than worth it if you can have a healthy baby. But again, you're still not addressing the underlying root cause. And I want to come on camera for a second actually here, because this is hugely important. If you don't address the root cause of the polycystic ovarian syndrome in the first place, the polycystic ovarian syndrome, in a way, is the least of your worries. Because if you have PCOS, you probably have very high levels of insulin. And the chances of you having diabetes, high blood pressure, even miscarriages, unfortunately, stillbirths, all that sort of stuff, fetal development issues, all that sort of stuff goes through the roof, exponentially higher. So chances that you're going to have those sort of issues are much, much higher. So again, if you don't address the underlying root cause, the underlying high levels of insulin, you're way more likely to have heart disease, cancer, dementia, Alzheimer's, Parkinson's, all of these chronic diseases that are rooted in high levels of insulin. So, instead of just taking the blood pressure medication or taking the metformin or doing the IVF, if we look to the root cause of these conditions, we can have true essentially, it's curing of an issue. You're going to the root cause and you're getting at it at root level, as opposed to just treating the symptoms that we see. And then finally, with the cysts themselves, usually they'll either remove them by surgery, and even though that tends not to be all that successful, because they'll come back again if you don't address the root cause. And then laparoscopic ovarian drilling, which is basically drilling a hole in, or cutting off. You can do wedging as well, where they kind of cut off a section of the ovary so that it grows back without the cysts. So again, all of that, when you think about what that is, it sounds like madness when you can get rid of it just by taking carbs and sugar out of your diet. So if you're looking to treat, polycystic ovarian syndrome, but also erectile dysfunction and low sperm count, these are the foods that you would eat much less of. Bread, rice, pasta, breakfast cereals, fizzy drinks that are full sugar, high sugar fruits, starchy vegetables, cakes, and pastries. And there was a guy actually in the States in a clinic. I think his name was it was Michael Fox. I could be wrong, but I think it's Dr. Michael Fox. He's over in a fertility clinic in the States. You'd often see him on Diet Doctor. And he had a diet that he called the best baby diet, or something that sounded like that. It was a fertility diet, and it was beef, bacon, and butter. So high fat, zero or very low carbohydrate diet, which was exceptionally successful. I think they published a study a couple of years ago saying that 90% of patients who went on that with PCOS conceived within 3 to 6 months, which is nuts, because it's very difficult to conceive if you have full-blown PCOS. So we swap out these foods and we eat higher fat, higher protein foods. The other foods that are, I would say, crucial for conception: cholesterol, saturated fat, red meat. They're going to be hugely important, those ancient ancestral foods. I've been saying this for quite a few years now, but there's wisdom in that evolutionary, the foods that we've had as all throughout our evolution. So meat, eggs, cheese. And if you think that those foods are bad for you or clog up your arteries, well, then we're a couple of years behind the science, because it's very, very clear now that they're not. And there's many consensus statements to say that saturated fat does not increase your risk of heart disease. We know now that's absolute nonsense. Eggs do not give you high cholesterol. They contain cholesterol, but they don't give you high blood serum cholesterol levels. In fact, they may improve it. And animal products, as a general rule, do not increase your risk of cancer, contrary to the poorly structured and flawed epidemiological research that we've heard quoted over the past 30 or 40 years. So these ancient ancestral foods are what we should be eating: meats, fish, seafood, full fat cheese, full fat butter, olive oil, green vegetables, avocados, eggs, basically meat, eggs, dairy, fruits, vegetables, with the exception maybe of high sugar fruits like bananas and grapes. So just to show you a couple of really interesting case studies, this is a patient who was 32 years of age. She was technically obese. She had pre-diabetes and PCOS, and you will often see these two going together, because again, pre-diabetes is high blood sugar levels. When your blood sugar levels are high, your body produces insulin. Insulin is what causes PCOS for the most part. She hadn't ovulated. She is in about 5 years. She was trying to conceive and had 3 rounds of IVF, and she was on clomiphene citrate and metformin, and nothing was working. So this is a typical story. So she spent about 35, 40 grand trying to fall pregnant. I remember this one clearly. I nearly said her name, but I won't. I know she gave me permission to, but I just don't like saying it anyway. That's her quote at the bottom, by the way. So I remember her saying to me, I want this so bad. I can't explain to you how bad I want it. She got all upset. It was back in the days when we were doing face-to-face consultations. And I wanted it so badly for her because she was a lovely girl as well. And she said to me, I'm going to stick to this through anything. There's nothing is going to throw me off this. And I just remember thinking how much she wanted it. And about 6 or 7 weeks in, I was monitoring her weight. And I remember seeing her weight gone up 5 or 6 pounds. I remember thinking, that's unusual. That's not like her. And then she didn't turn up to an appointment. And I was thinking, what in the name of God is going on? So I texted her and I said, look, do you want to pop in? I see your weight has gone up 6 or 7 pounds because we were kind of monitoring weight at the time. And she said to me, okay, look, I have to say this to you because, we've been working so well together and you've been good to me and stuff. And she just said, I can't believe I'm about to say it, but I'm pregnant. So she was 8 weeks in. She was down 19 pounds. So she was doing really, really well. And she had scans that showed an 80% reduction in the size of her cysts. Her PCOS was reversed. An ovulation issue was gone. She was ovulating again. The testosterone levels were down. The hyperandrogenism had resolved. And 2 weeks later, she fell pregnant. So between 8 to 10 weeks, it was somewhere around then. And she went on to have her son, Casey, who's probably about 2.5 or 3, probably about 3.5 now. And this one is really interesting because often people will say, oh, you need to lose weight if you have PCOS. Not true. So you don't need to lose weight, but the thing that reverses PCOS, lowering your insulin levels, usually causes a lot of weight loss as well, if you have weight to lose. But 30 to 50% of PCOS sufferers are normal weight. So this is one of my patients who was 34 years of age, normal weight, BMI of 20, so she was about 9.5 stone. PCOS was diagnosed by ultrasound. Again, she was pre-diabetic, hadn't ovulated in 3 years. Almost identical story. 2 months in ready care control. She only lost 1 pound because I kept her calories high, but kept her carbs and sugar low, reversed her pre-diabetes. Month 3, she fell pregnant. So there you go. So, I mean, it's hard to believe that it's that straightforward to put something that's so destroying and devastating for a patient to go through into remission like that so quickly, but it really is if you get to the root cause. Same thing, by the way, with erectile dysfunction, unless it's something structural, unless it's something obviously structural, like, if you're getting much older in your late 70s, early 80s, and you have erectile dysfunction, that may not be high insulin levels. But if your blood sugar levels are high, what happens is when your blood sugar levels are bounding around the place and they're too high for your body to control, it damages the small blood vessels. And if you think about where you have small blood vessels, you'll see they're all the areas that type 2 diabetics have problems. So fingers, feet, toes, eyes, mouth, where they get kind of blisters and ulcers that don't heal, poor wound healing, again, small blood vessels. And you also see it in the kidney, liver, pancreas, and genitals. So that's what happens with erectile dysfunction. So that's a real canary in the coal mine. If you're young and you're having erectile dysfunction, I mean, it could be psychological, it could be structural. Chances are it's insulin resistance. Your blood sugar levels are trending high. So by keeping your blood sugar levels low, oftentimes you can reverse that or certainly make it a lot better. Sperm quality as well. Lots of research say that if you eat more fat and protein and less carbs and sugar, your sperm quality goes up, your sperm count goes up. And you're much more viable. So hopefully that's helped someone out there. If you know someone who needs to hear this or could benefit from it, feel free to share it. Don't forget to like the video and subscribe. Thanks for joining us, and we'll see you again next week. Take care, everyone. Bye-bye.